With so much going on in this world, such as pandemics, loss of a loved one, murders, child abuse, family violence, and more, I'm sure at some point you must feel very worried, nervous, or unease. Whatever emotional distress you are going through, you are not alone. You're not alone in feeling overwhelmed, insecure, or nervous, or fear. There is someone that cares, that can listen and help you find an effective solution to those emotional feelings. I'm a clinical mental health counselor, and I can help you with these psychological distress that affect many. I practice CBT with patients, meaning cognitive behavior therapy. This type of therapy has two approaches. It recognizes thoughts alone and behaviors. Integrating both thoughts and behaviors makes an effective therapeutic process. CBT is not a specific treatment, but rather an umbrella term of diverse groups of treatments that all have in common the application of cognitive and behavior techniques, aiming at promoting symptom reduction, change irrational beliefs, and behavior change. There are many techniques in CBT. We can use one or we can combine them. These techniques can help you, and here are a few. Technique 1, self-talk. Self-talk empowers clients to monitor their internal dialogue, which most people are able to do at 8. This will be a dialogue that would help you think positive, affirming self-messages, and simultaneously blocking self-defeating or negative self-messages. This technique will help you dispute irrational beliefs and develop healthier thoughts, which will lead you to positive self-talk. Now, let's talk about a second technique, bibliotherapy. The usage of books, videos, films, movies, for example. This will help your way of thinking. By reading a book, for example, you are able to identify with a character from the book. You can learn how to solve your problems and explore new ways of interacting. Third technique. This can be a complex one, but a very effective. Rational emotive behavior therapy. In short, we call it REBT. It's a technique that helps the client understand the feelings are not caused by events, other people, or the past, but by thoughts the person has developed surrounding the situation. And the goal is to change one's irrational beliefs into more flexible and rational ones. It will help the client get an insight in their self-talk, for example. It would also help the client assess their thoughts, feelings, and behaviors. And lastly, it would train the clients in the principles of REBT so that they will function more effectively in the future without the help of a professional counselor, and that's the goal. Now, there have been some studies, and according to Bauman and his colleagues, CBT has a strong evidence base to support its effectiveness for a range of psychological disorders. According to a survey done, specialists that practice this type of therapy, 78% of them agree that the quality of life or level of functioning were the most important outcomes measures for evaluating treatment success. Also, in a study done by Davis and Turner, they used a ideographic single case design to assess the effects of one-to-one rep on the irrational beliefs, self-determined motivation, vitality, and sleep quality of 4 individuals. When they collected data, they found that the rep technique was successful for those individuals, for those 4 individuals. So I want to quote one of the pioneers of CBT, Albert Ellis. He stated, "We have a strong tendency to make and keep ourselves emotionally disturbed by internalizing and perpetuating self-defeating beliefs such as these, which is one reason it is a real challenge to achieve and maintain good psychological health." So we just need to conversate, share your thoughts. I'm here not to judge you, but to help you with your psychological distress. Find help. Now is the time.